So one of the things that struck me, and I know this again has been a part of our running conversation, is where does Gen AI fit into all of this? It's the topic you can't get past. I can't tell you how many using AI to revolutionize healthcare taglines I've seen on the floor over the last couple days. AI is everywhere. Gen AI is everywhere. What does it mean for health in particular and for consumer-centered health, maybe more specifically? Is it a difference maker? Is it a transforming agent? How does it fit into the puzzle here? What are your thoughts?
It's interesting when we talk about Gen AI or AI today, or maybe even a year or 5 years ago, there are many of us who just couldn't quite wrap our heads
Hmm.
around what it means. Now, having been in healthcare for over 25 years, I would say I use the analog of other things that came about that we couldn't wrap our heads, and now we can't imagine
Hmm.
living without it, right? So the internet. I remember sending my first email out in college
So do
after
I.
dialing
Yeah,
up, right?
yeah.
And now the ways that we use the internet and the internet of things, we don't even think about the technology. We just know
Hmm.
that our world is fundamentally different.
Yeah.
So specifically in healthcare, what AI and Gen AI are going to be able to do is take the reams of data that we have, let's say on clinical trials, whether it's cancer data or any other topic, to generate insights that we as humans just have a limitation and a
Yeah.
capacity on. It's going to help us not just diagnose and track when we have an heart, arrhythmia, or when where our sugar spikes, but it's actually going to help us understand what to do about it. So yes, Gen AI has already started to revolutionize the way the work is done, but I think in the future, Neil, it's actually going to change who does the work.
Interesting.
I mean, as a
Yeah.
physician, I wish I had a Gen AI tool that would help me think through a differential diagnosis and come up with the right diagnosis for a patient that was seeking my help.
Yeah.
I think Gen AI and AI are revolutionizing already, but we haven't even started to imagine what's absolutely
It's
possible.
interesting. And as we sort of digest that comment, then how does it implement itself into the ecosystem, right? Because I think what you and I have probably learned over our careers is not everybody's so eager for change, and not everyone's so eager for role transformation. Because as there's new technology, there may be some folks who feel like their influence wanes. How do we think about that element of technology adoption? Because even your example of the internet, there's some retailers that ended up losing everything because you could buy it online cheaper and get it within a couple of days. So how does that play out? And how front of mind should that be for us as Deloitte as we're thinking about serving our clients?
For us as Deloitte, I think we have to have an ethical and responsible framework of how Gen AI is applied, right? And so what that means is there needs to be trust embedded in all the things that we do. And you develop that trust by creating explainability,
Hmm.
transparency, by understanding the hallucinations and where AI can potentially lead us the wrong way. Now, I think to be at scale, ultimately, what needs to happen is that the consumer, the physician, the health plan leader, the biopharma medtech leader
Hmm.
needs to truly believe that the outcome is better because Gen AI is being used. So I think sometimes
Mm,
we focus on, is the technology good enough? And
right.
it's like if we're really focused on cost, quality, experience of care, and the experience for the caregiver,
Yep.
once AI starts to demonstrate that it actually can be
Yeah.
better, it's going to be a
Yeah.
no-brainer.
It's a wonderful reminder that the use case matters more than the technology itself. That's fabulous. So Gen AI and the future of health continues to be this transformational point on the journey towards the new healthcare. Exciting to continue to watch and see. More to come from CES, live from Las Vegas.